My name is Richard Harpster. Welcome to the presentation, The COVID-19 Spike Cause Nobody's Talking About. What you learn during this presentation could save your life or the life of someone you know. During this presentation, you will be provided with evidence on why the following are not true. First, the key to controlling COVID-19 is testing. Second, masks are not an effective form of COVID-19 control. Third, you have to shut down the country to control COVID-19. Fourth, a 100-day mask mandate will significantly reduce COVID-19 spread. This may seem like a contradiction to item number 2, but you will learn why it is not. You will learn that there is one cause of the COVID-19 spike that no one wants to talk about that could be resolved fairly fast and would significantly impact COVID-19 spread. Finally, you will learn what you can do to protect you and your loved ones from the COVID-19 spike. Important. During the presentation, you will be presented with information provided by different sources who use 3 different terms to describe the covering someone puts on their face to provide COVID-19 protection: mask, facial covering, and respirator. You should assume for the sake of this presentation, they are the same thing. The most prevalent misconception is that other than a vaccine, the key to controlling the spread of the COVID-19 virus is testing. As of December 4th, the U.S. has performed 580.42 tests for every 1,000 Americans. By comparison, South Korea has performed 60.34 tests for every 1,000 South Koreans. As of December 4th, the U.S. has experienced 43.41 infections per 1,000 people versus South Korea's 0.72 infections per 1,000 people. With U.S. COVID-19 infections since the first infection 60.3 times higher per 1,000 people than South Korea, while the U.S. has performed 9.6 times the testing of South Korea, clearly increased testing is not the key to improve COVID-19 control. Another common misconception is that masks are not effective at controlling COVID-19. Like the U.S., South Korea detected its first COVID-19 infection on January 20th, 2020. A survey indicated that approximately 19% of the population was wearing KF94 respirators at that time. The KF94 respirator has equivalent performance to the N95 respirator recommended by the FDA and CDC for use by American healthcare workers. In an effort to increase KF94 respirator usage by the South Korean general public, from January 20th through March 5th, the South Korean government implemented 8 different actions. These actions are shown on the chart. On February 29th, infections in South Korea reached their highest level at 909 daily new cases. Just 30 days later, there were only 30 daily new cases for a drop of 96.7%. The South Korean success in controlling COVID-19 has continued. The daily new confirmed COVID-19 cases per million people chart, which is shown, captures infections since January 23, 2020. On December 4, 2020, South Korea's 11.37 new infections per day per million people is 60.5 times less than the U.S. 688.47 new infections per million people per day. While South Korea awaits a vaccine, the KF94 respirator has proven to be extremely effective for controlling COVID-19 virus spread. Another popular misconception about COVID-19 is that you have to shut down the country to control it. As you can see by the examples provided of the South Korean pharmacy, street crowd, store, and voting center, many normal activities can go on while COVID-19 is still kept under control. South Korea has proven that if the general public properly wears facial coverings that are designed to protect the wearer from infection by the public and protect the public from infection by the wearer, most activities can be engaged in with minimal risk of COVID-19 infection. South Korea has been reasonably successful in limiting the damage to its economy due to COVID-19. The projected drop in the South Korea 2020 GDP when compared to 2019 is expected to be minus 0.9%. In 2021, the South Korea GDP is expected to increase by 3.5% over 2020 levels. The final misconception that we will look at is that a 100-day mask usage mandate will significantly reduce COVID-19 spread. While it is true that it would be beneficial if 100% of the American public wore a mask, one fact that is often lost is how many Americans are currently wearing a mask. Based on a recently published study conducted by the CDC, whose results are shown above, 88% of the American public 18 years old and over were wearing a mask in June of 2020. In a National Geographic poll published on October 5th, 92% of 2,200 Americans surveyed said they always or sometimes wore a mask when leaving the house. The question that must be asked as the American public mask usage begins to approach the South Korean public mask usage is, why are we not seeing the same success that South Korea saw after getting the vast majority of their people to wear masks? The answer to the question is simple. Most Americans are wearing ineffective masks. The CDC has recommended 3 different face coverings: sewn cloth, t-shirt cloth, and bandana cloth. The primary cause of the COVID-19 spike, and the cause that no one wants to talk about, is that the 3 CDC recommended facial protections are ineffective at both preventing infection of the public by the wearer and infection of the wearer by the public. The ineffectiveness is being exposed by a combination of factors. Before we examine these factors, we are going to first examine why the CDC facial coverings are ineffective. There are 2 key features that every effective COVID-19 facial covering must have. The first key feature is excellent filtration. The second key feature is an excellent seal between the facial covering and the face. In the next 3 slides, we will compare the South Korean KF94 respirator with the 3 CDC recommended facial coverings with respect to these 2 key features. The chart provided shows the filtration capability of the South Korean KF94 respirator and 10 different materials commonly used to make the CDC cloth facial coverings. A 0.3 micron particle filtration was selected as the baseline for filtration comparison because it is believed that the COVID-19 virus infection can be caused by exposure to COVID-19 aerosols. The 10 common materials used in the CDC cloth facial coverings had an average filtration capability of 25.28% compared with the South Korean KF94 respirators' 94%. The KF94 respirator is designed to protect the wearer from infection by the public and the public from infection by the wearer. It provides an excellent seal with the entire face, including the nose area, that is typically the most difficult area to seal. In order to assist with sealing in the nose area, a formable piece of metal is inserted into the mask. The CDC recommended facial covering rectangular shape is modeled after the surgical mask. The surgical mask is designed to keep the surgeon from infecting the patient by typically stopping between 75 and 78% of 0.3 micron particles from the surgeon's nose and mouth. However, due to its rectangular shape and lack of a metal insert in the nose area, the surgical mask does not provide a good seal to the face, with gaps normally found in the nose area, cheek area, and chin area. The CDC recommended facial coverings have the same sealing problems as a surgical mask due to their rectangular shape and a lack of metal insert in the nose area. Here is a matrix showing the South Korean KF94 respirator and the 3 CDC recommended facial coverings. The South Korean KF-94 respirator has a 94% filtration capability for 0.3 micron particles and provides an excellent seal to the face. Consequently, it provides the public with excellent protection from infection by the wearer, and the wearer with excellent protection from infection by the public. The CDC sewn cloth 2-layer face covering, when made with 600 thread count 100% cotton, has a 22% filtration capability and provides a pore seal to the face. Consequently, it provides the public with pore protection from infection by the wearer due to its inability to stop small aerosol particles. It provides the wearer with pore protection from infection by the public due to its inability to stop small aerosol particles and the pore seal to the face. The CDC T-shirt face covering, when made with a 100% cotton T-shirt, has a 21% filtration capability and provides a pore seal to the face. Like the CDC sewn cloth face covering, it does not provide effective protection for the public against infection by the wearer or effective protection for the wearer against infection by the public. The CDC 4-layer bandana face covering, when made with a 100% cotton bandana, has a 20% filtration capability and provides a pore seal to the face. Like the CDC sewn cloth and CDC T-shirt face coverings, it does not provide effective protection for the public against infection by the wearer or effective protection for the wearer against infection by the public. Following are 2 quotes from the CDC and 1 quote from the FDA that clearly show both the CDC and the FDA know that the CDC recommended facial coverings do not protect the wearer from infection. First CDC quote: "At no time has CDC guidance suggested that masks were intended to protect the wearers." This is the CDC's response when questioned about the high number of survey participants who wore masks that became infected during a CDC study. CDC quote 2: "During a pandemic, cloth masks may be the only option available. However, they should only be used as a last resort when medical masks and respirators are not available." This is the CDC guidance for healthcare workers when healthcare workers ask if they should use the CDC recommended facial coverings. FDA quote: "Cloth face coverings, whether provided by the employer or brought home by the worker, are not respirators or disposable face masks and do not protect the worker wearing them from exposures. Cloth face coverings are only intended to help contain the wearer's respiratory droplets from being spread." This is from the FDA website. Although the CDC and FDA know that the CDC facial coverings do not protect the wearer from infection, the majority of the American public does not. Based on one study, 2/3 of the American public believe that the masks they are wearing keep them safe from the virus. When I see people wearing the CDC recommended mask or a cloth gaiter that is less effective than the CDC mask, I ask myself the question: would Americans act differently if they knew the mask they were wearing did not protect them from infection? Would they stand next to someone who had no mask on or who was wearing their mask below their nose? Would they board an airplane loaded with people who had ineffective masks on? Finally, would they allow their children to go to school with a mask that did not protect them from infection from other infected children? America opening up and mass gatherings have led to decreased social distancing. The decreased social distancing has led to increased density of COVID-19 particles in the COVID-19 aerosols. Due to colder weather, people are spending more time indoors where COVID-19 aerosols are easier to create. Evidence suggests that decreased humidity allows the COVID-19 aerosols to stay airborne longer. The higher density of COVID-19 particles leads to increased chance of infection. When one combines the increased COVID-19 particle exposure with the ineffective CDC mask, it creates a recipe for a COVID-19 spike, which we are currently experiencing. The instructions for making ineffective facial coverings on the CDC website must be replaced with instructions that describe how to make facial coverings that protect the American public from infection. You now know the importance of wearing an effective mask. While you are waiting on the CDC to do the right thing, there are things you can do to protect yourself and the people you care about. Make sure you have a proper mask. If you are not sure, watch the YouTube video. Find out if you have the right mask in 2 minutes. If your mask is not what you need, perhaps it can be improved. Watch the YouTube video, Improving the Mask You Made or Bought. If your mask cannot be improved, it is possible to make an effective mask out of readily available materials for $5 to $7. If you look hard enough, some excellent masks are available for purchase at a reasonable price. Before you do anything, make sure you watch the YouTube video, 5 Things You Need to Know Before You Make or Buy a Mask. When you get an effective mask, make sure you use it properly. A mask that is not worn over the nose and mouth does not do the wearer or the public any good. When going to a public place, make sure you put your mask on in the car and leave it on until you return to the car. Make sure you handle the mask properly. Assume every worn mask has COVID-19 on it and handle it accordingly. Do not shove it into your purse or into your pocket. Wash or sanitize your hands immediately after taking it off. If you wash your mask, remember the 2 things that kill the COVID-19 virus. Wash temperatures over 140 degrees Fahrenheit or bleach. As a reference, 140 degree Fahrenheit water will burn your hands in 6 seconds. If you end up caring for someone with COVID-19, make sure you wear a mask designed to protect you from infection. With the increase of COVID-19 infections, there's a high likelihood you may find yourself in this position. Visit our website at www.wearamasksavealife.com to obtain more information. Everything on the website is free. We do not sell anything, nor do we recommend you buy anything from anyone else. Our goal is to educate people on COVID-19 to decrease COVID-19 infections and to save lives. If you found this video helpful, please share it with your friends. Thank you for your time and have a great day.